Good afternoon, ladies and gentlemen. For those watching at home, thank you for tuning in. We certainly appreciate all of our media folks being here to cover this. The purpose of today's press briefing is to discuss the current status of COVID-19 in Victoria, in particular the increased number of COVID-19 cases we've had over the last week, but also to remind our residents that this is still an issue that merits appropriate precautions. As most folks are aware, the number of positive COVID cases statewide has increased significantly this week and last week. Texas saw the largest increase in the number of positive cases in a single day on Wednesday, with 2,054 new cases in Texas. There have been nearly 10,000 new cases statewide from yesterday to the prior Thursday. So in a 1 week period of time, about 10,000 new cases. Here in our community, we've seen the number of active cases go from 19 to 39 in a week's time. Our medical folks will speak more directly to that here momentarily, but the mayor and I wanted to take this opportunity to remind the community that we can't disregard this as a threat. Fearfulness certainly is not helpful, but we can't let common sense precautions go to the wayside. Even though we're not under any stay-at-home orders, business is back up and running, we still need to take appropriate precautions. And those precautions are the common sense things we were talking about daily a couple months ago, and we've talked about since. If you're running a fever, don't go to work. If you have symptoms, get tested. To the extent practical, avoid large gatherings, wash your hands, and certainly those in an at-risk category should be extra cautious. We aren't mandating anything new today. The mayor and I are simply asking and reminding our fellow residents to be careful and to be smart. In terms of a county operational perspective, we are back open, up and running with common sense precautions in place. Commissioner's Court is meeting in person once again. However, I do want to remind folks that we've added the ability of the public to listen in and participate via Zoom, even though we're there in person. So for folks who would rather participate in our meetings from home, that's an option that's available to them. With those few brief remarks, I'll turn things over to Mayor McCoy, and then we'll have our medical folks out here.
Thank you, Judge. As the judge indicated, cases have been going up. I can't say that it was not anticipated. I think everybody understood that when things started opening up again, that the likelihood of more cases would be there. But what we have to do is the same as what we've been telling everybody for months here. I was trying to think of an analogy, when we left here, when you get antibiotics for any kind of illness you may have, and they're there to take for 14 days, and the bottle says on it, take all of this medicine, even when you start feeling better. I think we're somewhat in that predicament now. We had a period where the case count was going down, and we all started feeling a little better. So our analogous antibiotic in this case is the same old thing: social distancing, reasonable wearing of masks, and hygiene. That is what we must do, and we've got to keep doing it until we're fully well in this situation. I think there are things people should do in their personal life. I took my first trip, a business trip, out of town this week. I left Monday to go to Weatherford, Texas. That's a long way up there, and the last part of the trip is usually through Waco and on into Fort Worth and big metropolitan areas. Well, I looked at the map and went west out of Waco and made my trip through smaller communities. Now, was I 100% protected? No, but I think I minimized the odds greatly by not exposing myself to places with large amounts of people and stuff like that. And that's the sort of thing I think we all need to do as we move forward in opening up and living with the reality of this virus. There are things you can do. I kind of laugh. I said, here's my little travel kit right now. This and that. Hand sanitizer and a mask. And, have I gotten a little lax with it in the last few weeks? Sure I have. That's human nature. But when this starts happening, you start thinking about these sorts of things. And, I don't advocate wearing a mask. I don't wear this when I go out to get my mail at the mailbox. But if I'm walking into a place with a lot of people in it, I will wear this mask. And you've got to remember, this mask is not for your protection. It's for your fellow citizens' protection. I think that's the science behind the masks. So people need to know when to do it appropriately. These are great little things that are supposedly coming back on the market. They're not as hard to find anymore. But those are the little things you can do to safely move forward in this environment we're in. And if you want things to stay open, and you want them to stay open safely and continue, you have to do your part. You must do your part in taking these measures to protect yourself and, more importantly, your neighbor. I'll speak a little bit to the city. I've had a discussion with the city manager about our operations, and we're trying to prepare ourselves to have some of these scheduled events, but everybody is working diligently to have them in a safe manner. The July 4th event with social distancing and the appropriate things. So everybody's cognizant of this, and I'm sure the city, and I have every confidence that the county will do the same thing. But we're going to try to deal with the situation we've got. But as the judge said, we felt it was important for he and I to come here today and speak to this matter because that's what we did at the beginning of it all, and we just wanted people in the community to know that we are concerned about it. We still think about it. We still have conversations about it, and it's present with us every day. So just do your part, and we'll all get through this. And now I think we'll just turn it over to the medical experts.
Absolutely. Are there any
questions
for us before they come out?
Judge, Mayor, if we continue to see the case counts climb in Victoria, will you consider additional orders or regulations either affecting businesses or individuals? We
particularly, the way that the situation is now under the governor's present orders, we have no plans on issuing any local orders. It's pretty much established under his orders that his orders trump all of ours. So I don't anticipate that we'll be issuing any orders in the near future.
Do you think the governor has reopened the state too quickly, or that his orders are too lenient?
I think it certainly is and has been necessary to reopen the economy and for people to be able to get back to work. It's worth pointing out that this is something everybody acknowledges will be with us for a while, and it's just not practical to have an economy in lockdown. So, no, I think it's good that things are opening back up, but there are precautions even still that need to be taken in terms of what we're able to do locally. Like the mayor mentioned, the governor largely removed the abilities of local officials. However, in spite of that, my primary concern is doing what's best for our community, much more so than towing the line of any order that comes down from the state. That being said, I think with what we're seeing now, it's things being done on a voluntary basis is still sufficient. But we felt a reminder was appropriate. Certainly seeing, another fatality recently, 11 new cases yesterday. These are things that we monitor daily, that the mayor and I visit about, if not daily, then every other day. And we thought the reminder was prudent. And as far as some of the medical details, Dr. McNeill and David could speak better to that here momentarily.
One thing I would caution against, the state of Texas is a very large state, and it's made up of a lot of real urban areas and a lot of rural areas. So I would caution people when you compare the genesis of these outbreaks or these new numbers. I don't think you can compare Victoria to what's taking place in, say, Dallas or Houston or large metropolitan areas. I think the dynamics of the spreads are probably different. And what the judge and I have done since day one is we rely on those experts who are about to come in here to speak to you to try to make our decisions based upon what they tell us about our community. Okay?
We had a question here.
Is there a number that you guys have in mind where maybe you feel like that would change?
Not necessarily. This is something that's monitored on an ongoing basis. There aren't set thresholds that would trigger certain things at this point. It's something we monitor continually with the advice and assistance of our medical folks.
Okay.
Any other questions?
Anything else? All right. Thank you all once again.
Good afternoon. My name is David Gonzales. I'm the director of the Victoria County Public Health Department and have Dr. McNeill, the Victoria County Public Health Authority, here with me today, as Judge and Mayor pointed out. Just kind of wanted to brief back on a few things, coming back off the second highest daily case count we had yesterday at 11. Just wanted to come back with some recommendations and reminders for the general public. So to break down a few numbers, today we're at 200 cases now total in Victoria County. 153 of those have recovered. We currently have 39 active cases. And then today we've had 3 new cases as of 3 p.m. Just really want to point out that want the public to keep in mind that COVID-19 obviously still very present in the community. We want the public to understand that the risk is still there. We had a great month and a half of low case counts and low case totals. They're very happy about, and we're pleased about that. But again, this is a very harsh reminder that it's still present very much in the community today. Keep in mind the recommendations are still the same. We recommend facial coverings in public, social distance when you're in public, and as well as social activities. You want to wash your hands frequently, good hygiene, and then most importantly, stay home if you're sick. If you're symptomatic, make sure you're not going out in public, you're not around folks to be able to spread whatever illness that is. And we've seen a wide variety of symptoms when it comes to COVID-positive patients, from very mild to moderate to even very severe. So a couple of questions we've gotten is, where did the new cases come from? We've had speculation on, where they come from. But really where we found most of the new cases that come from are in extracurricular activities, public gatherings, social settings, family gatherings. We are going to have close extended contact to COVID-positive patients and cases, and that's really where the high risk comes into play. When you have extended periods where you're in discussion, you're talking with people, you're sitting across from them, maybe you're eating meals with them, that's really where those risks increase, and that's what we're kind of seeing now with these new cases. Right now, we have currently 5 Victoria residents hospitalized currently. Fortunately, none of those are in the ICU, so that is definitely a very good thing. Just, we'll be available more so to take questions at the end, but I want to kind of pass it along to Dr. McNeill and let him kind of give us a few ideas and a few thoughts.
Yeah. Thanks, David. And, and we're back. Basically, we're back in response to what appears to be an uptick in this disease. And I'm not saying that we're surprised. I'm kind of surprised it took this long, to be honest with you. The numbers had dropped and it was looking good, and maybe we became a little complacent as far as our social distancing and the things that we're doing. You can look on the media at any time and you're going to see large groups of people, at the beach and large other events and venues that are going on. And, there's just not a lot of social distancing going on. And people really need to understand, just like David said, this disease is still out there. It's still very contagious. And it's coming back, and the numbers have increased. I can tell you that the numbers that we have now, I think, are lower than they're going to be. In other words, they're going to increase. We have a lot of things that we've seen where we have known COVID patients that have been in groups of large people. We're tracking those. We're doing the best we can to find out how those are going to pan out. But I can tell you that this disease is out there. It's out in the community, and I want people to be careful. Just like we've always said from the beginning, a lot of these rules haven't changed. We want people to social distance. We're talking, 6, 10 feet if possible. We're talking about extended periods of time. The Centers for Disease Control has slightly modified the amount of time that they think that it takes for a person to be in casual contact and transmit the disease to another person. So in other words, 10 minutes was initially. They're now saying that really 15 minutes. So what I'm saying is that if you pass by somebody in a restaurant, you pass by somebody wherever you're at, and you get close to them, and that person, you find out the next couple of days turns out to be COVID positive. That's not really a significant risk. That's a low risk. And that's the reason we don't report every one of those. We find out about people when we do their contact tracing. Brittany and our wonderful group of experts that are helping us and doing this stuff every day, doing the contact tracing, they look back and they see where this person has been and what they've been doing. And we don't call everybody and say, okay, well, they went to XYZ store and there were 17 people in there and they were standing next to each other in line for about 30 or 45 seconds. Well, that's not a significant exposure. Now, was this person coughing on you? I mean, if somebody coughs on you, that's a different story, okay? But there you go. What prevents that from transmitting? A mask. So there we go. Wear a mask, watch your social distancing, and know that this disease is still out there. I don't want people to get complacent. And remember now, the asymptomatic spread, I mean, the jury's still out on that. The World Health Organization came out the other day with one story, then they kind of modified it. So we're not 100% sure exactly what that is. And anytime you see major organizations change their statements as to what's happening, that just simply tells you that we don't have a good understanding of this disease. And a couple of months ago when we were up here every day, or whenever it was, I always said we don't completely understand this disease. And guess what? We still don't completely understand it. We have a little bit more knowledge, and we are probably better at preventing it than we used to be, but there's still a lot to learn. So a lot of things on the forefront. There's a rule in medicine, the squeaky wheel gets the oil, and this is a pretty significant illness, so it's getting a lot of research, and there are a lot of people working on it. Okay. So final thing, and then we'll take questions, but really just remember that this disease is still out there, folks. It can still hurt you. Even though you're young, it can still make you pretty sick, and it can kill you. There are young people that have died from this disease. So not just that, but if you're a carrier and you're asymptomatic, you're going to spread it to people, and you can spread it to a bunch of people. And if you spread it to someone that's elderly, mainly your family, then that person can do very poorly, okay? We still have people that are sick in the hospital, and I can tell you, I called before we got here, and David, this is my fault. David, I didn't tell you there is one in the ICU.
Okay, there's one now.
They haven't been in there that long. Mm-hmm. But there's still patients that are still getting very sick from this. So, we have to be careful of that, and we have to take care and watch out for ourselves and watch out for our families. Because remember, who do you spend the most time with? Your coworkers and your families. And that's where most of this disease spread occurs. Okay.
Sure.
Asymptomatic, 50%, I was just reading that this morning, 50% of people who have COVID are asymptomatic. Does an asymptomatic carrier have the same duration as someone who is showing signs?
I wish I knew that. So, I mean, there's a big question about that. You know, we think that when a person is exposed to the disease, and this has to do with testing, and this is an important point too, when people, they say, well, I saw a guy last night and he called me today and told me he has COVID. I need to get tested. No, you don't need to get tested. You need to give it a little bit of time so you can develop the disease if you're going to. So, but if it was a casual contact like that, then you have a low and very minimal risk. So, as far as being able to know when you're transmitting the disease, we do know now that at least 48 hours before you show symptoms, you can still shed virus and you can still spread this disease. And that's the scary part about this, is that the guy standing next to you in the line at HEB, or the guy next to you, or the person you're talking to, or the person you go up to in a restaurant and sit down at their table and talk to them for a few minutes, you know, these are people that could have the disease and not know it. And I would hope that they wouldn't go out when they're sick. That's the most important thing too. If you're sick, stay home. That's all there is to it. And what do I mean by sick? Well, okay, do I have cough, shortness of breath, and fever? All right, that was all nice and fine and dandy in the beginning when that's what we thought was the main symptoms of this. Well, now, sore throat, sinus type infections. I've seen a bunch of patients that their chief complaint was, I've got another sinus infection. Well, you've got a sinus infection because you have COVID. So those things do happen. So gastrointestinal complaints, I mean, sore muscles, there's a plethora of different symptoms that are exhibited by different people. Some people get this disease, they progress rapidly. In a few days, they're on a ventilator. Some people get the disease, they have a mild sore throat, they feel a little fatigued, and 3 days later, they feel fine. They both have the same virus. So it's completely variable.
Is it possible to have the COVID, be asymptomatic the entire time and never show any signs?
Absolutely.
Okay.
And there are a lot of people, and that's what they're talking about when we're going to do the antibody testing at some point, to look back. And we will find people that had the disease that thought they had their yearly allergies or thought that they had just a routine illness. Okay? It manifests itself in such different ways. Well, minimal symptoms. I mean, I wake up every morning with a runny nose at times. I mean, everybody, you live in South Texas, you probably have South Texas allergies. But some people, this is their only symptom of COVID.
David, of the 200 positive cases, do we have a total number for how many of those needed some kind of hospital care?
Total number of hospitalizations, I may have that. Let me look for that. Do you have another question, follow-up question? I got to look for that data.
Do we have any local data about how many of our 200 cases have comorbidities or other pre-existing conditions that might have complicated the virus?
Yeah, no, we're not really reporting on that, and we don't have easily accessible data. It would be go back in patient confidentiality to be able to report out that data.
We've talked a lot, and we've heard also from the judge and mayor that we kind of expected this to happen. I guess if we expected this to happen, I mean, won't the case counts just keep growing? I mean, what's to stop people from continuing to get sick?
What's to stop it? Unfortunately, very little. We don't have a vaccine. We have a bunch of different things that we think might work if you become infected. But what we do have is social distancing and wearing masks. So we stick by it. I mean, you use the weapons that you have. And since since the very beginning, that's all we've said. And that's pretty much the same.
You mentioned before that a lot of the, I guess, recent cases are being spread in social gatherings. I mean, do you think that the guidelines are too loose around when we're allowed to socialize at the moment?
That's going to go back to I think what Judge and Mayor may have touched on earlier as far as the governor's orders and opening up the economy and things. I think it's really a balance. I think it's a balance of, trying to move things forward, but also, it's up to the public on taking those necessary precautions and making sure, I hate to keep going back to it, but, wearing facial covering in the public. And if you're not out when you're sick, then nobody can get sick that way. You can't contract the virus if, other sick folks aren't in the public. So, it's a tough question to answer. I think it's really a delicate balance between the two.
We really have two different ends of the spectrum there. We have barricade yourself at home, and at the other end of the spectrum is go to a party on the beach with 400 people, okay, with no masks and no social distancing. So in the middle there, it's just like everything else in life. There's a happy medium. There's something in the middle where we can still open up our economy. We can still do things safely. I get it. I've looked at the numbers, and I can tell you, I work in the emergency department, and I see patients that come in that are afraid to come into the hospital. And the patients that I'm seeing in the emergency department now are sicker than they typically are. And we keep track of these numbers because we know exactly the percentage of how many we admit, and we call it our acuity rate. And we know that our acuity rate is higher. And our acuity rate is higher right now because people are afraid to go to the hospital. They're trying to stay home. They're trying to avoid this. They think they're going to get sicker if they go to the hospital because they don't want to get COVID. Let me take this opportunity just to say this. If you're sick and you need care, go get care. Go to the hospital. It's safe. We're very careful about that. I mean, we wear masks. We keep everything clean. We socially distance patients. We do what it takes to keep you safe. I'm telling you that there are a lot of people, I mean, worldwide, I mean, the numbers are easy to see. The cardiologists are talking about the people that are dying at home from heart attacks because they don't want to go get care in the early phase of their cardiovascular disease when they could be helped. So that's just one example. I see patients that come in that have to go straight to surgery because they've had abdominal pain for a week with their intra-abdominal problem that required surgery that they didn't do anything about. So some of these patients do worse because they're afraid to come get help. So we are stressing, and we're trying to make people understand that coming to the hospital when you're sick is okay. It's a safe thing to do. We'll put a mask on you if you don't have one on when you get there. We'll all wear masks. We'll take care of you. And we'll use universal precautions. But we'll address those other issues that you may have.
I mean, just to follow up quickly, I mean, how do you speak to both groups? The one group of people who's too scared to go to the hospital to get care, and then the group of people who's on the beach without masks in close proximity to others who are prolonging the life of the virus potentially in the community?
Well, I'd say please go to the middle. I'd say the people that won't go, you need to go. The people that are over here at the beach, spread out. All right.
I just wanted to reiterate, you guys do feel that the numbers will probably get higher?
I do.
Yeah. Yeah, I mean, I don't think it's I guess they go at this point, and, you know, the more active cases you obviously have in the community, the more risk there is in the community.
Yeah.
So, you know, as our cases grow with new active cases, especially over the last day we hit that many, I guess it wouldn't be surprising, you know, at all if we do see an increase based on, because keep in mind, you know, over the last, you know, month and a half, 2 months, you know, a lot of people were staying home. You know, as a concern, you go to the store and you see, you know, 50, 60%, 75% people wearing masks. You may go to the store today and you see 10%. So, you know, definitely that's what's changed. Human behavior's changed. You know, folks were maybe tired of being home, tired of being cooped up, so they're going to get out and about, and things are available to do so. So that really is where the increased risk, and it would make complete sense for these numbers to go up for the increase in number of active cases along with the increased social activity. There's really no reason that, you know, it would not go up at this point.
Do you guys see any potential for a certain number, like a certain number of cases where we would go back to shutting things down again?
You know,
Yeah,
that's David's question.
You know, it's two things, and I think Dr. McNeill can touch on this as well. Is there a magic number? No. Is there a number we're looking at? I think there's a bunch of different factors, and you know, it's just like a response to a lot of the questions we had early on about, you know, what's that number that we have different guidelines or different activities based on. You know, really we're going to rely on the hospital data also, and how busy, and, you know, their availability of ICU beds, vents, and, you know, just general ability to treat patients. And, you know, if that continues to go down, whether it's from COVID or something else, if we have something, you know, going to the fall, if flu is as bad as they think it's going to be, if we have, you know, ICU beds and vents overrun with flu, then it may be time to look at restrictions, you know, to prevent more COVID patients from going in there, to make sure that capacity does not get overwhelmed. So it's really a balance of, you know, hospital capacity, you know, acute healthcare system, and making sure that doesn't get overwhelmed, to have the ability to treat those patients.
And I agree completely with David. I think that's probably the barometer that we should look at, because one of the biggest fears with COVID is that we're going to overrun our healthcare system. And that's what happened in New York. I mean, they did everything they could, and they did a very good job. But what I'm saying is that right now, when I spoke to the hospital just right before we came on, they don't have very many ICU beds available. So that means, and there's only one of those beds being occupied by a COVID patient. So there are other reasons for people, of course, to be in the intensive care unit. But when it's already most of the way full, and then you throw COVID on top of there, and then you add a flu season that always increases the ICU admission rate, then you have a potential for danger. And patients that can't get to adequate care, of course, do worse. So you may have increased deaths just from that. Not from COVID itself, but the fact that the system is overrun and we don't have the ability to take care of them. We're not at that point now, but we're not in flu season. You know, traditionally in medicine, as far as upper respiratory and stuff goes, this is our slow time. I mean, September, October, November, December, January, February is when it gets a lot worse.
There was one step that every resident could take. Would it be wearing a mask? Would it be something else? What would be the one thing that you would ask folks to do?
It's one thing, if stay home if you're sick. Don't go to work, don't go to public, don't socialize, don't have family and friends over. You know, if you are sick, stay home.
And don't minimize your symptoms. Don't think it's just a sinus infection. So, and of course, social distance and wear a mask. You knew I was going to throw that in there. So.
In terms of outbreaks, is there anything to suggest we have any other outbreaks, or are there any other concerns in our congregate facilities, our jail, our LTACs, our nursing homes?
No, thank goodness, and we were talking about that before we came in. You know, we've been really fortunate to have not any further outbreaks, especially not with any of the facilities with those vulnerable populations. You know, we're very fortunate, very lucky, and I hope that continues. They've done a great job here locally, I know, in the county and region. Those long-term care facilities, nursing homes have done a great job in making sure that they don't have any outbreaks or any cases in their facility. And then definitely no outbreaks in the jail or anything like that. So.
And we've been very careful about that too. We've limited the number of patients or inmates that we've taken from other facilities in our jails, as well as the juvenile detention center and the county jail. So that's worked out really well. So I mean, we've done well in that respect, but it's because we took those steps early. And knock on wood, I hope it continues that way, because you know, once you get the disease in a confined area like that, it's a nightmare.
I don't know if you have the latest on this, but in terms of the testing done by our RAC for nursing home residents, have we gotten results back? Should we expect in a couple of weeks to see more cases because the nursing home residents and staff are being tested?
I think I think they got most of the results back, and I don't think there was any. There may have been a few positives, but I'll have to get clarification on that because I was handled outside of our department.
There was certainly nothing remarkable about it.
Yeah, nothing to suggest an outbreak or anything of concern that we had handled.
Will we meet again soon? Are you guys thinking we'll go back to 2 days a week, 3 days a week, or are we just going to be as needed again?
So I think we're going to be as needed.
I'll say I hope not. I mean, because that would
not
usually it's we come together when things get worse, and I hope that doesn't happen.
Yeah.
But you know, we definitely saw a lot of questions come up, and you know, obviously with the second largest day, we want to really come back and kind of reiterate and remind folks the situation we're in, and obviously the precautions to take moving forward. So there's nothing planned, but again, you know, as we stated when we concluded the first, the first round of press conferences a few months ago, you know, we stated that if something happens, we're going to come back together and we can make it happen within a few hours. And that's what we did today. You know, we had decided this morning we probably want to go ahead and do one, especially going into the weekend, just to kind of advise folks in the public and to you know, make sure they take proper precautions. One additional thing I did want to point out that I forgot about earlier, we are working with the state of Texas and the Texas Division of Emergency Management to provide some more avenues for testing. It's a new, I guess, initiative they've kicked off, and it's going to be walk-up test site. So there's not going to be any, from what we understand, not going to be any pre-approvals needed from a doctor or any orders as they go in. So they'll be able to walk in. The testing, I need to get clarification on that. It may be available at no cost, so I need to get clarification on that. And we're working those pieces right now, and we'll definitely share with the media and the public when those are available and where that location is going to be. Hopefully in the next week or two we can get that here in the city.
Just quickly, I mean, the mayor had shared kind of how he's been going through his life, kind of evaluating risk. How have you two changed your routines, if at all, from, say, April 1st?
You want to touch on that? Or?
Well, I had to quarantine myself, so that was an adventure. So I quit shaving. That was about it. No, but seriously, I mean, that's the thing. I've tried to be vigilant, but I'm telling you, that I can understand it because yesterday I walked into a convenience store and I walked in and I realized I didn't have a mask on. So that's the thing. You've got to keep thinking about it. And I probably fell victim to whatever I've been talking about because I just stopped thinking about it. But I think that's what we have to do. We have to just keep this in the back of our minds at all times and know that this virus is out there and it's going to be out there for a while. So other than that, I mean, we still aren't really doing as many family things. And if we do have anyone over, family-wise, we don't have other people over, but if we do, then we separate and we do it outside. So we're just trying to be careful because, folks, I tell you, with asymptomatic spread, I mean, the thing that got me quarantined was I had a meeting with a person that called me the next morning and said, I'm COVID positive. Or actually, they called me and gave me the symptoms. I said, go get tested, and they were COVID positive. So, and I was with that person for, 10, 15, 20, 30 minutes, whatever it was. And we were close, but we both had masks on. But still, I mean, it's still an exposure, so I didn't want to bring it to my family. So that's just the way it works. And it can happen like that. It can be simple. And something so innocuous as just visiting with a friend or talking to someone or being next to someone or, hugging someone, something like that. So we just kind of have to change the ways. And I've said it before, I'm not sure that shaking hands is going to come back. So we'll see.
Yeah, no, he did a lot of great points, Dr. McNeill, but I think really just weighing the risk and looking how, we're talking about this before we came in as far as what those risks are and what really this heightened risk and, that 10 to 15 minute exposure talking to somebody, if you're walking by somebody, in the store, in a restaurant or on the street, you really don't have a high risk exposure. So that's really what I try to do is weigh the risk. I wear my mask in public and, pretty much every congregate setting in stores and things. If I'm going somewhere real quick where I know not many people are and I can make sure I'm 10, 20 feet away from everybody and there's really no chance to be around anybody, then, I can weigh those risks and that risk exposure is none to very minimal. So I think that's really, obviously I don't think I've gone out to eat yet, so that's one thing I haven't done. But other than that, just really weighing those risks and being smart about what you do. Any other questions? Well, thank you all. As always, you can get more information from the Victoria County Public Health Department Facebook page and website, and also City of Victoria and the Victoria County Facebook as well. And that is all we have for today. So
Please be safe, folks. Stay safe.
Thank you.
All right.